Hello and welcome to vlog number 11. Today, at the request of YouTube user Christian Poisic, I'm going to talk about how different Parkinson's disease can be from one person to another. This is a huge subject because there are so many different symptoms of Parkinson's, but I'll attempt to do it justice at some level. I've never sought out the person-to-person company of fellow Parkinson's sufferers, and many people that I communicate with on various PD Facebook groups feel the same way. I've heard others say that they don't wish to meet other people with Parkinson's because they don't want to see how others are affected by the disease. If you meet another person with Parkinson's and they have more severe symptoms than you have, then you think that perhaps that will be you in a year or two. You see people whose Parkinson's presents differently to yours and wonder if or when you will start to suffer with the symptoms which you don't currently suffer with. Whatever, it is clear that it would be highly unusual to meet someone who has the same disease as you have and suffers the exact same symptoms. There's a saying, when you met one person with Parkinson's disease, you met one person with Parkinson's disease. Everyone's Parkinson's is different, and a person with Parkinson's might have only one symptom or might present with a whole array of symptoms. Symptoms can vary from day to day and from hour to hour, even sometimes from minute to minute. The obvious symptoms of Parkinson's disease are associated with movement and are known as motor symptoms. There are also invisible symptoms that aren't related to movement. Non-motor symptoms such as depression, pain and cognitive impairment. Most people, if asked, would say that tremor was the symptom that they would most associate with PD. But over 30% of people with Parkinson's do not have a tremor. Many people with Parkinson's have difficulty walking, whether it be difficulty in initiating movement or freezing, difficulty in stopping movement, balance difficulties, a short-stepped or shuffling gait, arms which do not swing naturally as you walk, difficulty in making turns. So you see that just one major symptom has a number of different features or subsymptoms. And one person with Parkinson's who has walking difficulties can present completely differently to another person with Parkinson's with walking difficulties. Another common symptom is bradykinesia, or slowness of movement, caused by the lethargy of the brain in transmitting instructions to the muscles that control the body's movement. This can vary dramatically from one moment to the next. 1 minute you can be moving normally, the next you're frozen, rooted to the spot. It can also affect facial muscles, giving a mask-like appearance and affecting non-verbal communication, which can be most frustrating. Muscles can weaken and cramp painfully and become inflexible, resulting in rigidity and further hindering normal movement. Parkinson's can affect your ability to perform simple everyday tasks which were once taken for granted. Your handwriting can become smaller and illegible. You may find it difficult to get your coat on without assistance. You could find it difficult to get coins and notes out of your wallet or purse, etc., etc. You could suffer with swallowing and choking problems, excess saliva and drooling. Your voice could become husky and soft, or worse still, disappear altogether, further impacting communication and making the person with Parkinson's feel isolated. These are just a few of the obvious signs and symptoms of Parkinson's. If you look on the internet for a list of symptoms, you'll also find the following: restless leg syndrome, anxiety, falls, dizziness, sleeping problems, skin and sweating problems, fatigue, dementia, depression, memory issues, hallucinations and delusions, bladder and bowel problems, vision problems. Some of these symptoms can be caused or exacerbated by Parkinson's medication, and sometimes it's hard to know whether it's the illness or the medication that's responsible for a symptom. Now, a person with Parkinson's disease may have one of these symptoms, a selection of them, or perhaps all of them, so you can appreciate how different each person with Parkinson's could appear. My mother also has Parkinson's, albeit more advanced than mine. I have severe tremor. She has little or no tremor. She has difficulty in verbal communication because her voice is now reduced to a whisper. I have a softer voice than I used to have, but can still make myself heard and understood. She has severe postural instability and on a bad day is unable to stand or walk without using a walking frame. I have some mild balance issues, but am able to walk unaided. She has frequent freezing of movement. I do not. We both have dystonia in our feet. She has medication-induced hallucinations. I take no Parkinson's medication and do not suffer hallucinations. Long may that be the case. I hope that I've been able to give you some understanding of the nature of this dreadful condition and helped you appreciate how differently it can affect different people. Thanks for watching. If you have any questions or have a topic that you would like me to cover in future vlogs, just leave me a message in the comments and I'll do my best to respond. Enjoy your week. See you next Friday.